Cancer and inflammation. Um, Inflammation has gotten a lot of attention lately, and it's a process that's normal for the body, but cancer can be both a benefit to the body as a really normal part of our immune system, healing from injuries, etc. But when inflammation allows is allowed to go on too long, it turns chronic from acute. And in its chronic form, it actually can be very harmful. It underlies lots of chronic diseases like diabetes, heart disease, and yeah, cancer, which is what we're here to talk about today. So let's go on to the next thing. So just to make this a little bit more clear, acute inflammation is like the word name implies. Got a fast time frame. It starts from within hours usually of the injury or infection or whatever the insult is to the body. Um, and this inflammation allows the body to give a rapid response. It
On my
ratchets up.
work phone in my purse.
Oh, okay, Irene, you're gonna have to mute yourself. So inflammation um, allows the acute part of the immune system to turn up and turn on really quickly. It dilates the blood vessels. It brings in a lot of extra blood so that all the healing materials and healing cells can come to the area of injury, inflammation, or infection. And so acute inflammation revs up and gets our police force ready to go. Everything that needs to be done. The predominant cell are white blood cells, granulocytes. If you've ever been tested for an infection and they say, "Oh, your white count's high," that means that these kinds of cells that respond, the quick-acting cells responding to infection or injury, are high. The signs, we learned them when I was a medical student in Latin: rubor for redness, tumor for swelling, um, uh, calor for heat, and dolor for pain. So if something that's red, swollen, hot, and tender, that's signs of acute inflammation. And we talked about what happens in the blood vessels. They get leaky, so that into the injured tissue they get leaky, and that leakiness allows healing cells and healing substances to come into the area acutely, and this turns on quickly once the injury, insult, infection is handled. The normal mechanisms inside the body turn off of the acute inflammation, and it's all done. So you sprain your ankle. It's sore and swollen and tender for a couple of days. You cut your hand. Again, red, swollen, tender, bleeding. But the bleeding clots, the swellness and redness goes down, and that's the end of that. Surgery is an example of a medically induced injury that, again, it's a lot of inflammation right around the time of the injury, but you want that to maximize healing. That's the good part of inflammation. Now, the more challenging part of inflammation is what we call chronic. It's slower. It lasts months to years. Believe it or not, that word is years. It can take a long time to ratchet up. It doesn't have to be out of control. It can be very mild, sort of subtle, or it can be uh, a raging fire. Um, the common cell types are macrophages and lymphocytes, which, as we know, are much more implicated in cancer, the development of cancer, the continuation of cancer, etc. Um, like we know from the acute kind that gets red, swollen, tender, etc., chronic inflammation often is very silent. You, you can have a fairly significant amount of inflammation, and you don't have a lot of symptoms. Or if you have symptoms, there's systemic symptoms and there's subtle symptoms like fatigue is one example of chronic inflammation often, or it can be related to the tissue of origin. So if you have an inflammation in your bowel, you'll have bowel type symptoms, etc. So in the tissue, there's new blood vessel formation. That's called angiogenesis. Angio meaning blood, genesis being new birth. And this helps promote tumor growth and metastases. And this kind of chronic inflammation is slow to resolve or may not resolve. An example of this are chronic infections like an ulcer, H. pylori, an ulcer, a non-healing sore, tissue damage like ulcerative colitis, Crohn's disease, etc. Stuff like that. So now, you all may have seen a version of this before. This was first published around the year 2000, and this researcher, Hanahan, uh, published what was a new way to think about cancer. And it summarized about a decade's worth of research where it said normal cells behave in a certain way, and for a cell to become cancerous, it has to lose a lot of the activities of a normal cell. So, normal cells, for example, don't live forever. They grow until they're damaged, and then the body has mechanisms to automatically cull those cells out and kill them, basically. So, if a cell had genetic damage, it often wouldn't be allowed to perpetuate because the body knows that's a cell that's not compatible with healthy life, so it takes it out. Cells tend to be um, like townhouses. They grow so far, they touch each other, and in touching each other, they stop. Cancer cells grow all over each other, so they've lost that recognition of a proper boundary. Um, it's unusual for cells to grow new blood vessels, but cancer cells have to grow new blood vessels or they won't be able to support the large growth that happens as a tumor gets bigger and bigger. Um, it's very unusual for a normal cell to be able to leave its organ and get in the blood system and go travel all around and find a new place to set up an outpost. But that's called metastases. That's very common in cancer, as we know. And often it's the metastases in cancer that are more deadly even than the growth at the local site and this evading immune destruction. The body has a whole lot of systems that check to make sure that all the cells that are here are our own cells. They're not foreign cells from outside, they're not damaged cells of our own, and this involves a natural killer cells. It also involves antigen and antibodies that find abnormal cells, hook them up, take them to be destroyed. Okay? So that tells you something about the hallmarks of cancer and how they change when to allow a cancer cell to become essentially immortal, live forever, grow in an ever growing heap. But here's some of the ways, and specific ways in which inflammation helps promote those things to happen. So first of all, DNA damage. A normal cell has normal genes, normal mitochondria, normal genes. And the DNA in those genes are fine. And the body has ways to unzip the DNA and take out defective parts or repair defective parts. It when there's chronic inflammation in the body, it's like having a constant irritation. If someone's in the making a lot of noise, and you're trying to concentrate on doing a delicate task properly, it's not surprising that you would make a mistake because that kind of chronic irritation interrupts your normal process. That happens with DNA. DNA gets damaged more easily when there's chronic inflammation. It leads to ROS, reactive oxygen species, reactive nitrogen species. These are things that have an extra electron usually, and they come in and bang into the cells and bang into the DNA and knock pieces off or knock pieces out of alignment. So the DNA strand can break or it can be modified in a way that's not healthy. And when those events happen, repair doesn't take place very well. And if you have a repeated cycle of injury, repair, proliferation, so the cell gets injured, it gets repaired, but it gets misrepaired. So when this comes time for the cells to divide, um, every time they divide with these mistakes, they get amplified. And so these mistakes eventually end up with cells so abnormal, they start to lose the hallmarks of normal cells. And when the cells are damaged, they're called mutated, and clones is just a clump of cells. So a mutated clone is a clump of abnormal cells, which then allows that to grow and grow. and a large enough clone, a large enough clump, and it turns it into a tumor. The other thing that needs to happen is this apoptosis, which is programmed cell death. So that means that if a cell's too damaged or too old or not functional, there are mechanisms housed in the mitochondria that then turn the cell off and tell the cell, time for you to self-destruct. You're not a useful part of the collective anymore, self-destruct. And the way this happens is inflammation leads to um, inflammatory signaling pathways that are turned on by inflammation. The signal gets louder and louder and louder, and this um, turns turns up the proteins that block apoptosis and turns down the proteins that the anti-proliferative proteins. Now, there's a last thing that most people don't know about in the lay public about DNA. We think it's just the DNA helix, that thing that we've all seen in grade school. And that's true. That's where all the genes are. They're all along those little ladder shapes of A, T, C, and G. And clumps of those together make genes. But it turns out that there's other stuff that regulates how many times genes get expressed, which means decoded, programmed for proteins, direct the body's activities, and how many times they get shut down. And the material that does that are certain kinds of chemicals all along the sides of the DNA ladders. And those are methyl groups, which is one particular kind of chemical, or histones, another kind of chemical. And how those chemicals, proteins, and other carbons and hydrogens are folded either opens up the gene to be decoded or covers up the gene so that it's protected. If the genes that are opened up are cancer promoter genes like P53, then that's what happens. And that turns on a lot of cancer promoting activities in the body. If the histones and methyl groups cover up that gene, then that gene doesn't get expressed and that gene stays hidden. And so even though you might have the gene and you have the risk of that, it doesn't get turned on, opened up, and decoded and made into an activity in the body. So inflammation um, opens up the promoter genes and closes off the inhibitor genes, which is the opposite of what we want to have happen. The nice thing about this epigenetics, this means epi means around, genetic means the DNA helix, the DNA material, epigenetic around the genes. The reason why this is such an interesting way of modifying gene expression is that these histones and methyl groups are actually quite responsive to lifestyle interventions, and in fact, this is a way lifestyle usually modifies cancer risk, which may or may not be genetically inherited, and the status of your epigenetics can also be inherited um, from your mother before birth. So, keeping a good, healthy lifestyle keeps your epigenetics in good shape so they promote um, cancer genes to be turned off, promote inflammatory proteins from being turned on, and allows this healthy state of your genes to be expressed. Whoopsie. Now, we know that inflammation has an active part in cancer because we see this. We see conditions that are known to be highly inflammatory states have an increased risk of colon cancer. For example, ulcerative colitis. This is called inflammatory bowel disease, IBD. Ulcerative colitis, Crohn's disease. And this is when the lining of the intestinal tract, small intestine for Crohn's, large intestine for ulcerative colitis in the colon, when that because of autoimmune conditions, inflammatory conditions, stays like an open sore, but it's an open sore inside your body. And unless control of that process is obtained either by medication, by lifestyle, or both, then it's as if you have a big burn on your arm all the time. And that's a problem because this burn promotes inflammation just in and of itself. And remember, every time you heal a tissue, every time you repair a tissue, the potential to make a mistake is there. So if you heal a tissue one time, that's one mistake. If you have to heal a tissue 10,000 times, that's 10,000 opportunities to make a mistake. So the more inflamed and irritated a tissue is, the more likely you are to make a mistake in healing that. If those mistakes are consistent enough and bad enough and aggregate in exactly the wrong way, then cells become an irregular clone. Clone goes on to turn into cancer. And so the inflammation from the autoimmune condition in the bowel increases the reactive oxygen species, which helps make DNA damage more likely, which means that the lining of the digestive tract has to turn over a lot more and mutations accumulate. With enough mutations or enough repair mistakes, cancer develops. Now, another example is a chronic human papillomavirus HPV infection. You've probably heard about HPV. There's a new vaccine for this that's recommended to be given to adolescents before they become sexually active and before they get exposed to this human papillomavirus, which is sexually transmitted. So this virus has a bunch of different versions of it, some of which are relatively benign and some of which are really deadly. If you get infected by one of the bad actors, one of the bad HPV viruses, human papillomavirus clones or subtypes, then it increases your risk of cervical cancer. And for the women in the group who've had to have pap smears, you're looking for abnormal cells around the cervix, which is the mouth to the uterus to the womb. So that's a tissue that gets exposed every time you have sex. And if it's heterosexual sex, that is usually, and if the virus is present in your partner, it can be transmitted to you. You likewise can transmit it to your partner um, by the similar mechanisms. And and the cells lining the cervix, if they get infected, they again, which they then set up a chronic, like an infection, and this infection again isn't promoted by inflammation, is exacerbated, made worse by inflammation, and is allowed to persist by inflammation. And then eventually the cells start to look abnormal. And that's what it means to get an abnormal pap smear. Now, cervical cancer is almost completely preventable if caught in this early stage before it's even really a cancer. As soon as the cells start to look a little funny, you can take all the abnormal cells away and then have the cervix set back to normal. Um, and if the body is then able to get rid of the HPV infection, no problems. Okay? But that's why every woman has to have pap smears pretty much every year of her sexually active life. Now, another example is chronic hepatitis. This is when you get infected by the hepatitis B virus, HBV, not a P, but a B. And this infection that's much more common in Asia. And again, just like with the HPV, chronic infection damages the liver. This liver tries to repair itself. It makes these regenerative nodules. And in those regenerative nodules, again, the opportunity for mistake. If the infection is persistent enough, if it integrates into the DNA of the liver, if it continues to perpetuate accumulated mistakes in healing, DNA mutations, then that turns into hepatocellular cancer. Very similar thing with esophageal adenocarcinoma. This is bile injury from acid and bile acids washing back up into the esophagus, damaging that delicate tissue. Again, and in repair, more problems happen. And this picture's not super big, but it'll give you the idea of, here's a bunch of cells. They're growing. They look relatively decent. And over here is all the different signals that promote inflammation. And over here are all the signals that turn down inflammation. If this side dominates, it goes on to if there are not very many of these different abnormal type inflammatory signals, then you get very restricted tumor growth. You don't get any new blood vessels, and the tumor can only grow so big, it can't metastasize, basically rarely turns into a problem. If you have if you have if you have balance, is someone ask, does someone want to ask a question? Allison? If you don't need a question, then mute yourself if you don't mind. Okay, I don't want you to throw me off my game. Okay, so if the it's like a teeter-totter. If there's anti-inflammatory is dominant, then then you get less angiogenesis, less inflammation, the tumor swell goes down. If all those things are turned up, if the pro-inflammation is turned up and the anti-inflammation is turned down, that's the worst outcome, then your tumor grows very rapidly, and those can be quite serious tumors. And we know this because if we measure your inflammation in your body at the time of your diagnosis, and that inflammation level is high, it's a bad prognostic factor. People with very high inflammation tend not to do as well. Okay, now obesity also causes inflammation. This inflammation is a little bit different. It's not the raging fire of ulcerative colitis, rheumatoid arthritis, etc. But it is it's a low grade, consistent, persistent inflammation, and it happens because the um, the fatty tissue in your tummy around packed all around your internal organs, that's very active. It's a very active hormonally, and it's very active in that it releases a lot of signaling molecules. And this fat doesn't act normally. Fat should be relatively inert, but this fat is very active and affects your metabolic system and affects the promotion and development and continuation of inflammation. It sends out increased signaling molecules that say, make more inflammation, make more inflammation. It also increases resistance to insulin. So, insulin normal activity in the body is it takes sugar from food and pushes it into cells. If the cells are resistant to that, then the sugar backs up in the blood. And in a very simple way, you then end up with diabetes, well, too much sugar in the blood. Diabetes is a very pro inflammatory disease. Obesity also affects the kind and variety and amount of bacteria in your gut. So you tend to have less variety, less good bacteria, and more inflammatory promoting bacteria in the gut. And all of these factors together adds up to a tumor promoting microenvironment. And there are a number of cancers that are more likely to happen if someone is obese. Breast, colon, prostate are just three, and those are three of our most common cancers. And you may have been reading in the in like on your news feeds and stuff how GLP-1 drugs, Ozempic type drugs, which turn off or turn off leptin. This is a satiety. This I- this stimulates appetite, and adiponectin turns off your appetite. So what GLP-1s do is turn down leptin. So two things happen. It turns off a pro-inflammatory signal and it makes you eat less. So therefore you lose weight. And lower weight means lower fat around your organs. That's less inflammation right there. Hopefully, as you lose weight, you become more active. That decreases inflammation, etc. So this tells you how obesity relates to making cancer and how some of the anti-obesity drugs are being shown now, brand new research, how these drugs are being shown to reduce the risk of some cancers. Now, causing cancer to be more likely to happen, that's bad. That's bad in and of itself. But inflammation also interferes with the treatment of cancer, and that makes it particularly insidious. It's also particularly difficult because as chemotherapy, radiation affects cells, it kills cells. As cells break down, the cell debris, the cell breakdown components get released into the blood, and that's a very strong pro-inflammatory signal. So that's a problem. Cancer treatment itself increases inflammation. The hope is that it's only temporary, that once the cancer's under control, that extra stimulation goes away. But in the meantime, it can make it harder to treat the cancer. So high inflammation promotes tumor resistance. It counteracts apoptosis, that's spontaneous death, and initiates repair of abnormal cells. Now, it doesn't repair them back to a normal cell, but it repairs them enough that they can divide for the next generation. Okay. It also activates cell survival pathways, those ones in that the abnormal survival pathways, the virtual immortalities. These become like the Voldemort of cells, right? So they can become, in essence, they survive forever. And then they also increase the resistance to chemo and radiotherapy, which mostly react by damaging the cells so much that they can't survive. That just either damages the cells so they can't divide, it breaks them apart with radiation, it causes a level of damage that can't be repaired. So you can see how having extra inflammation turns on some of the protective mechanisms for abnormal cells. Now, it's also true that when you get a drug, your body reacts to that. The body finds most drugs to be what we call zoonotic substances. Xeno meaning stranger. Okay, so the body tends to deal with them in a couple of different ways. The first thing it does is there are pumps. There are little pumps right at the wall of the GI tract. So as you swallow something orally, it it tends to take substances, and some things it preferentially pumps in, like glucose, it tends to pump in, and then it tends to pump out drugs. With a high enough level of drugs, the amount pumped out is about the same as the amount that's pumped in, so you get a good level in the blood. If inflammation is present, it turns on the pump out. So it tends to get rid of more of the chemotherapy drug. So it's not present to attack your tumor cells. The other thing that inflammation does is it turns on or inhibits, depending on which, the enzymes housed in the liver that break down drugs. So if it turns up an enzyme that breaks down a drug and it turns it up really high, then that breaks the drug down so fast that it's just washed right out. It becomes inactive and doesn't affect the tumor like it should. And the other thing it does is that inflammation tends to create an immunosuppressant microenvironment. So it turns on T cells that turn off other T cells, turn off natural killer cells, turn off activated macrophages, turn up the tumor associated macrophages, which hide and protect the tumor cell. And therefore, it gives you a decreased response to immunotherapy, which are where a lot of our modern new drugs are. And then dysbiosis, it promotes abnormal bacterial growth, kind and amount in the digestive tract, which also decreases the response to immunotherapy. So, what can you do? That sounds pretty bad, I guess, if you hear it from the outside and you think there's nothing to be done here. But that's not true. There's a lot that can be done. And a lot of this is under your control. What you eat is under your control, and Laura's going to talk to us about that in just a second. If you exercise enough, sitting sedentary, not doing enough exercise, not doing any exercise, promotes inflammation, and in fact, exercise actually makes treatment work better. Stress management. When you're stressed, your own hormones inside your body, your fight or flight hormones go up. Those things promote inflammation. Remember, inflammation is an emergency response, and if your body always thinks something terrible is about to happen, it's going to turn up those chemicals. Arriving at and maintaining a normal weight is important. We're going to talk now, although this is much harder said than done, um, that's where I think the new GLP-1s can come into effect, and what you eat is again going to affect this. Now, we're going to talk for a second about medications and supplements that are anti-inflammatory. So some of our most common drugs are anti-inflammatory. A lot of over-the-counter medications for pain are anti-inflammatory because remember, pain was one of the signs of inflammation. So aspirin, ibuprofen, naproxen, this is Motrin, naproxen, and then prescription drugs like celecoxib all act on pro-inflammatory systems inside the cell, and they tend to disable either um, either turn them down or turn them off, and it's been shown that some of these medications like aspirin and celecoxib were helpful in promoting the development of some inflammatory related cancers. And one of the most recent studies that I read, which is really exciting, said that after the treatment of colorectal cancer, so you've been treated either with surgery, radiation, or both, and you're thought to be free of disease, if it turns out that you actually still have colon cancer cells circulating very, very small amounts in your blood, that if you're given celecoxib, that decreases your your incidence of recurrence. So cells circulating in your blood, you're going to get a recurrence. No cells circulating in your blood, no recurrence. The celecoxib turns the people who have the circulating cells so they look just like the people who have no cells at all. Very big deal. Statins have been shown to be associated with reduced risk of some inflammatory related cancers because statins, besides lowering cholesterol, are also anti inflammatory. Now, there are anti inflammatory herbs, which probably the most one that's been studied most for cancer is curcumin, which is basically a turmeric extract. And it's definitely been shown to reduce the side effects in some cancer treatments, which are almost always inflammatorily mediated. These herbs have not been tested for prevention of cancer or prevention of recurrence yet, although in animal models they are showing some benefit. There are additional other anti-inflammatory supplements like vitamin D and omega-3 fatty acids. Vitamin D helps with immune response and helps mitigate an overstimulated immune system. We saw this in COVID, that if your vitamin D was normal, it turned off this robust, out of control inflammatory response so that your acute inflammation could resolve and end. And omega-3 fatty acids have been helpful in something called cancer cachexia, which is when inflammation makes you lose weight no matter what you eat. And that's a very dangerous condition in cancer. But now we're going to turn this over to Laura so she can talk to us about an anti-inflammatory diet and give us some tips on what and how we should eat. Over to you, Laura.
All right, let me turn off some of these windows. So inflammation and diet. This is something I like to talk about a lot because, as Mary said, there's some things you can do about inflammation. And by the way, in addition to being an oncology nurse, I'm a health supportive chef and culinary translator. So what I hope to do is take a little information about inflammation and its connection to diet and talk to you how you can translate this into something edible and delicious. So you're going to get a handout of all the slides we have, and then any links on the slides you can access. But Cancer Choices has a whole handbook on inflammation. It takes a lot of what Mary's been talking about, what I've been talking about, and gives you practical things that you can do to manage inflammation. So what foods and diets are related to chronic inflammation? Well, certainly the SAD or standard American diet, which has lots of sugary or diet drinks, refined grains, processed meats, and not eating enough of the cruciferous vegetables like broccoli and cauliflower and cabbage, any of those vegetables that have cross patterns in the leaves. And also your deep yellow and orange vegetables. A high-fat diet, especially trans fats and not good quality omega-6 fats, And an example of what I'm talking about, if you eat a high-fat diet, like a fast food breakfast, uh, plenty of places have their own varieties of Egg McMuffins or whatever, and I used to love Egg McMuffins. I guess it's good I can't eat gluten because I can't eat those. But they increase your inflammatory substances in your bloodstream, and that lasts 3 to 4 hours. And then let's say your lunch is something similar, and then you get another 3 to 4 hours. And then your dinner is something similar, and your snack. So you could have hours and hours of these inflammatory substances in your bloodstream. Some other things that fan the fires of inflammation, Mary talked about obesity and body fat around your abdominal organs. Dr. Lisa Altshuler calls that angry fat. Now, I know smoking is not a food, but it is a big culprit of inflammation. And here's another example of a chronic inflammatory condition like periodontal disease is linked to chronic inflammation. So what foods help quench the fires of inflammation? Well, in general, fruits and vegetables and whole grains. So for instance, brown rice and not white rice, or quinoa is a whole grain, or millet, lots of whole grains. Leafy greens, especially your dark leafy greens, and avocados and beans, again whole grains, nuts and seeds, and a lot of these are high in magnesium, which decreases inflammatory substances in the blood. And by the way, when people are really stressed out, their magnesium levels tend to get low, and actually certain cancer treatments can lower your magnesium levels. So it's a good idea to get foods that have plenty of magnesium. Turmeric, or the active ingredient is curcumin, and Mary had that listed on the slide of natural products. Olive oil and flax and hemp seed and chia seeds and walnut oils are some examples of your oils and fats. And then wild-caught salmon or other wild-caught fatty fish that usually come from deep, deep in the ocean. I was ordering a salmon dish one day at this restaurant, and I asked the lady if it was wild-caught, and she goes, I don't know what kind of mood it was in when it was caught. So in general, what we're talking to is going for a fiber-rich, plant-based diet like the Mediterranean diet. And if you look at this link here, we have a review of the Mediterranean diet in Cancer Choices, along with some resources where you can get, a handout of what the diet is and links to places where you can get some good recipes and menu ideas for planning a Mediterranean diet. In fact, what does an anti-inflammatory plate include? And this is a graphic from the Anti-Cancer Lifestyle Program ebook on anti-inflammatory diets. And I put a link to it. It's very good in helping explain it. But look at that gorgeous plate with all the deep colors. It has lots of vegetables in it. And if you eat a vegetarian diet, then you could have tofu, which is derived from soybeans or other beans. Or if you eat like fish, then salmon would be a good choice in that corner for your high protein. Believe it or not, in your spice cabinet, you might want to consider it a medicine cabinet in your kitchen. And all of these culinary spices not only help give your food more flavor and personality, but it inhibits NF-kappa B. Well, what in the heck is NF-kappa B? Well, it's a family of proteins, and they can cause trouble when they get out of control. And they act like a master control panel inside cancer cells. And when it gets stuck in the on position, it triggers a chain reaction that helps the cancer grow and spread. And NF-kappa B also connects long-term inflammation to cancer development. And it can keep this inflammation can keep that NF-kappa B switch turned on, which over time can help normal cells become cancerous and help tumors grow larger and more aggressive. So imagine just opening up. I mean, we don't even have a good drug that inhibits this, but look at all these herbs and spices that inhibit NF-kappa B. I listed this slide because Mary mentioned that insulin resistance, diabetes, is connected with chronic inflammation. So you can kill two birds with one stone. This is basically showing foods that are good to decrease inflammation. They also are helpful in lowering the glycemic load. Mary mentioned something about the gut, the microorganisms in your gut. And a lot of these foods in here help to feed these microorganisms, and the healthy ones, and then they in turn feed us and take care of us. So you're seeing a lot of the same things I had on the previous slide also is good for your lowering your blood sugar and insulin resistance and reducing inflammation. And then I just thought I'd share with you some favorite recipes. I've got to add one in here. I'll bring it. I'll send it to you. But here's a salmon sweet potato patty with curry tartar sauce recipe that I share with all my patients who eat fish. And you'll get a copy of this. One of my interns at our Cancer Help Program retreats, Maggie Callahan, she made this recipe up for her dad, who really loved sweets, but he had leukemia and he was trying to cut down on how much refined grains and sugar he was eating, and also you look at this, it contains a whole bunch of those spices you saw on another page that inhibit NF-kappa B. These muffins are delicious, and you can make them with or without eggs. It's up to you, and they're high in fiber, and they freeze well. So if you make a ton of them, and if they make it to your freezer, great. These are really delicious in other seasons. If you want to put apples instead of cranberries, you can do that, or blueberries. Listed some resources on anti-inflammatory diets. So the Anti-Cancer Lifestyle Program, I mentioned their ebook. Website by the Fred Hutch Cancer Center, Cook for Your Life. They have a lot of different recipes, but they do specifically have recipes that are part of the Mediterranean diet. Savor Health is an AI program, a personal nutrition assistant, and we sponsor keeping a link of that up on the Cancer Choices website. And if you click on any of these, you'll get there. And then also you might be interested in having free access to an ebook of Rebecca Katz's online cancer fighting kitchen when you sign up for our newsletter.